supported every step of the way during the COVID-19 response. And I, from personal experience in being with the team, colleagues and fellow the challenges that Fiji was facing, and all I can say is your presence and your contribution there. Inia Siratu, Honorable Chanu Samate.
The Honourable Minister for Defence, Regional Development and Disaster Management, Sir Honourable Ines Ratu. Again, I'd like to thank you and congratulate you, sir, for the wonderful day that we had yesterday, the launching of the disaster awareness and preparedness by the Ministry of Regional Development and the National Disaster Management Office, ably led by Ms. Wasiti Soko. And also I'd like to welcome the Honourable Minister for Infrastructure and Lands and Mineral Resources. Sir, we welcome you again to the Ministry of Health. You're no stranger here, or formerly Minister for Health. You know exactly what we've been doing, and you've laid the platform before. We also welcome WHO and acknowledge her today, WHO representative in the Pacific, Dr. Corina Capuano, and thank you for the work that we've been doing together. And representatives from our partner organizations, COICA, JICA, World Bank, the Asian Development Bank, DFED, GIS, SPC, USP, and FNU, colleagues from the Ministry of Health and Medical Services, colleagues from other ministries, ladies and gentlemen. Bulubinaka, very good morning and to you all. And I'm very happy to be here at this high-level consultation on climate change and health and the guidelines for climate resilient and environmental sustainable healthcare facilities in Fiji. And we are doing this because we have led from the front. As you're aware, the Honourable Prime Minister is very passionate about climate change. He was president of COP23, and the climate champion is here with us today, the Minister for Regional Development, in his former role as Minister for Foreign Affairs and also as climate champion. And that's why I was very interested to see and to also hear from them today on what has been happening at high-level area, so that we can also be attuned as we begin to discuss over the next few days. Their presence and also the presence of WHO indicates that this is multi-sectorial, and that we completely believe in health, that whatever small successes we have is because everybody participated, not only the Minister of Health. It has to be led ably from the front, from the Honourable Prime Minister, the role of other organizations within government, the role of CSOs, the important role of development partners, and the role of the community. There was one thing that the UN Resident Coordinator said yesterday that really hit home. He said, it's one thing about having effective and strong leadership, but the other important thing is having a community that is able to listen to that effective and strong leadership. Because when the community is listening, then you can be able to bring about behavioral change. And this country has been able to make itself COVID contained, not only because of effective leadership, but because of the community that is able to listen and create that behavioral change. And that's where we are today in respect to COVID-19. We will launch the guidelines for climate resilience and environmentally sustainable healthcare facilities next month. And we must have heard also that Dr. Capuano was talking about how we're moving fast in this regard. As you all are aware, the WHO has just launched the global guidance for climate resilient and environmentally sustainable healthcare facility. This shows that we, Fiji, our urgency on the issue and how eager we are to roll up our sleeves and start the implementation of these guidelines. We cannot do this without the support from other ministries, other sectors and other partners. The other day we were sitting in the office, and Dr. Mesu and the team came and we looked through all the checklists that we had in place. It can be overbearing to have a look at it and to see what may need to be done, but I can also assure us that I've looked at what's happening in Canada, and they're nearly the same checklist. So irrespective of whatever country in the world, we all face challenges with climate change. The North Americans are facing issues with very severe storms, with very cold winters, and they're no different from the challenges that we face here. So from my Fiji perspective, when I see what's happening in the Northern Hemisphere, I realize that we are all facing the pressures of climate change. We all have to tick those boxes, irrespective of wherever we are. And we cannot do this, as I've said before, without the support of our partners. COVID-19 has reminded us the importance of the intimate and delicate relationship between people and the planet, and that we need to recover and build back greener. When we invest in water and sanitation, to clean energy, in healthcare facilities, we are actually investing in resilient health systems. And one thing that has actually impressed me is the fact that in some of the areas that have been hit by disaster, their first place where they could get clean water was the nursing station that had the tanks that were actually belted in well. So we're not only providing the health care in terms of disaster rehabilitation for the people that come into our setting, but also for the community when we are climate resistant. And I think that's an important thing that hit home to me, that we can also be an evacuation place, that we can also be a source of clean water, that we can also be a source of renewable energy when there is disasters. And this initiative is essential for Fiji as we continue to face the impacts of climate change and the increasing intensity of tropical extreme weather events that threaten the achievement of universal health coverage. And one thing that I was sharing yesterday in Bar is we cannot change our coordinates. We are linked and locked at 180 degrees. That's where we are. We're not going to be able to change that. We just have to accept the fact that severe weather storms are going to come our way. We just got to have to be prepared, and we have to do it with a sense of urgency. And that is one of the reasons why we are here today, to talk about how we can be able to work together to achieve Fiji's goal. UHC is a target of SDG and provides a platform to achieve health-related SDGs. UHC, or Universal Health Coverage, means that we will leave no one behind. We will reach the unreached without financial hardship. And the government of Fiji has significantly been investing in the health sector to ensure that Fijian people can access essential health services without financial burden. As Fiji has been actively addressed at the global stage, and also we have seen what climate change means to our daily life, climate change affects all aspects of life, including and importantly the health services. There was an article that came out recently that talked about in this COVID-19 pandemic, whilst the focus is on communicable disease, there is also a significant cohort of the population that are struggling with non-communicable disease. The inability to be able to access medicine because of the shortage of the global supply. The inability to be able to access healthcare because of lockdowns. The impacts of climate change cause setback in health developments. It affects the achievement of health outcome targets and the progress of capital projects, particularly through devastation of our facilities that suffered during cyclones, flooding, and other extreme weather events. When I came into the office, I looked back at our plans for renovation and capital development. It was all derailed because of Cyclone Winston. After Cyclone Winston, we had to repair quite a lot of our facilities. Namboa Hospital is about more than $3 million. Tawa Hospital, $2.5 million and still counting. As you are aware, we hopefully in the beginning of next year, we're going to open the new Bar Hospital. Nassau Health Center, which we hope to open before the end of this year, that was repaired at the tune of $900,000. So you can see there's been a significant renovations because of severe tropical cyclone Winston. And therefore it's important that we continue to push on into this end, because our progress of capital works and renovations are devastated and are derailed when we have severe storm events as tropical cyclone Winston. I would say climate change poses challenges to achieve UHC. Climate change poses a threat to reaching the unreached people, particularly communities that are affected by sea level rise. As I speak here today, Onyan Nursing Station and Vato, to name just two, are experiencing this threat of rising sea level. Not in the future, but right now. It is obvious that strengthened and climate resilient health systems are a means to achieving UHC. Then I encourage all of us to invest our time and resources in building climate resilient health systems to achieve universal health coverage and to protect our people from the health impacts of climate change. Health system strengthening refers to significant and purposeful efforts to improve health systems performing, demonstrating quality, equity, efficiency, accountability, resilience, and sustainability. Therefore, health systems should be increasingly strengthened to continue to be efficient and responsive to improve the population health in an unstable and changing climate. I'm pleased to say that building a climate-resilient health system in Fiji is made possible through the support of you, our partners that are here today. And I'd like to thank you and also acknowledge the continued support rendered by WHO and the Climate Change Unit and Technical Support Unit, which is now based out of Fiji, Nawale with WHO. The Ministry has its dedicated programs, plans, and strategies for climate change. We know that the challenge is not easy. We have 210 facilities. The support from the National Climate Change Division at the Ministry of Economy cannot be overlooked, and their representation here today confirms that this initiative complements the goal of National Adaptation Plan. The guidelines that we will look at today is another step to accelerate the transformation of our health systems towards climate resilience. We're not sitting back and waiting for these guidelines. We've already progressed in installing rainwater harvesting systems. We've also looked at putting in solar panels, and I've been also very encouraged that the Honourable Prime Minister, through the fund that he has in his office, has been supporting us in putting solar panels and actually solar electricity in some of our nesting stations that we have commissioned this year. We've also installed new LED lights at the Fiji CDC and sensor lights in the corridors of our new Nakasi Health Centre. I believe that the global COVID pandemic tests our health systems on how resilient the health system is and how well the system can evolve and serve its people. And as I've alluded, the Shocks of Winston, the Minister of Health, after that, worked very hard to ensure that our emergency medical team, known as FEMED, is WHO certified. As you all are aware, that happened in the middle of last year. We were the 9th country in the world, the first small island development state to be able to do that. And as I speak here today, there's a FEMED team with a FEMED field hospital in Balibutu in Ba. Yesterday I went back to talk to them. They did 21 operations, 9 tubal ligations in ladies who wanted to stop having children and carry on with life as usual. They did 21 yesterday. As I also speak now, there's a FEMED team on marine vessel Vebueti in the island of Coral, led by our plastic surgeon, Dr. Semesa. They will be in Coral and Ngau over the next 9 days. So you can see we continue to push out that irrespective of COVID-19, irrespective of climate change, we continue to push on. We are building the capacity of FEMED so when a disaster does happen, we can have a field hospital on the ground within 24 hours. I urge us all to actively contribute to these discussions. All of us have been asked to be here because we know, our Ministry of Health officials know that you bring something important to this table. I look forward to continuing collaboration with you all and our partners, including WHO, to achieve the targets of UHC and to strengthen our resilience to the impacts of climate change. I thank you all once again. I thank the Honourable Ministers for taking time to be able to share with us their experiences, and I wish this workshop all the best, and I'll be very interested whenever I have time to be able to pop in and to listen and to be able to hear and to be able to know what we need to do to become a stronger climate resilient Ministry of Health. Nawale.